Continuing on with the respiratory system, I want to talk now about the pleural membrane. So, this is a relatively simple concept that I know you probably remember from early in the semester, but the lungs are surrounded by a serous membrane called the pleura. And from what you remember about serous membranes, you know there's a parietal layer and a visceral layer. So, the parietal is on the outside, visceral on the inside. And in between the two, we have a serous cavity, which we'll call the pleural cavity in this case because it's going around the lungs. And really, that's it. So the pleura consists of two layers, visceral and parietal pleura. And then you have a pleural cavity that contains serous fluid, and that's what surrounds the lungs. So looking at the lungs themselves, so each lung is going to have a base and an apex. So the base is going to be the bottom part. The apex is going to be the pointed top region. The hilum is on the medial side where the bronchi and blood vessels would enter. So not a big deal, but it's just where the things enter the lungs, like the blood vessels and the bronchi. And one of the things that I do want to bring up is that the left and right lungs are different. So the left has two lobes. You can see them here. And the lobes are divided by something called the oblique fissure. And you see it's running like this, so it's oblique because it's running at an angle. The left lung is also different from the right because it has a cardiac notch, which is a little notch right here, and also a cardiac impression on the medial side. And obviously that's where the heart kind of pushes into it a little bit. And remember, most of the heart's on the left side, so that's why the left lung has these little places where the heart can kind of fit in. And then lastly, the left lung has anywhere from 8 to 10 bronchopulmonary segments, and I'll explain more about what that is shortly, but bronchopulmonary segments are just like little segments of the lungs. So if you want to consider like the entire lung is maybe the United States, each bronchopulmonary segment might be a little like a state, so like a section of it. But so 8 to 10 of those. We'll see those shortly. The right lung, 3 lobes. So not only do you have the oblique fissure, but you also have a horizontal fissure that runs across like this. So it gives us 3 lobes. 10 bronchopulmonary segments in the right lung, and obviously no cardiac impression or cardiac notch. Everything else, with the exception of the size and the lobes, is pretty consistent. So interesting point, and I want to just clarify something. There is a typo on this slide. So remember we talked about how the primary bronchi enter each lung. So like let's say on one of the lungs you have a primary bronchus coming in, and then it branches. Well, the first branches after the primary bronchi, they're called secondary bronchi, and this actually is supposed to be bronchi, not bronchiole. So each lobe is supplied by a secondary bronchi. So that means that within the lung, the right lung, for instance, is going to have 3 secondary bronchi. And so 1 primary bronchus coming in, and then 3 secondary bronchi, 1 going to each lobe. The left lung only has 2 lobes, so as you would expect, it's going to have 2 secondary bronchi. So these are the bronchopulmonary segments that I was talking about. So they're just regions of the lung. They're color-coded. You do not need to know their names. Just kind of know that this is the concept. And then the other thing I would want you to know is that, again, another typo here. This is supposed to be each bronchopulmonary segment is supplied by a tertiary bronchi. So again, when the secondary bronchi branch into tertiary, each one of those tertiary goes to a bronchopulmonary segment. So it's actually pretty organized in how these bronchi are distributed throughout the lung. All right, circulations, pulmonary circulations, we don't really need to discuss that again. We just covered that with the cardiovascular system. Basically, right side of the heart pumps to the pulmonary circulation. Blood goes through pulmonary arteries to the lungs, picks up oxygen, comes back in pulmonary veins, back to the left side of the heart. And that's the pulmonary circulation. So in addition to that, we do have a small circulation called the bronchial circulation. And this is basically the same thing as the coronary circulation of the heart. So the lungs themselves need their own blood supply, and that's called the bronchial circulation. So it bronchial circulation supplies the lung tissue itself with oxygenated blood. All right, as far as the physiology of breathing, I'm going to talk a little bit about this, but it's all based on pressure gradients. So the big muscle at work here is the diaphragm. So hopefully you remember the diaphragm sits beneath the lungs. And so if we're assuming atmospheric pressure out in the atmosphere and room air is about 760, it's probably a little bit less than that in most cases, but we'll just say it's 760. If the pressure in the lungs is lower than that, air is going to move in. So just assume for a moment that the pressure in the lungs was 755 and the pressure out in the atmosphere is 760. So you got a gradient there, so air is going to come in. On the other hand, if the pressure in the lungs was 765 and the atmospheric pressure is still 760, you got a pressure gradient going the other way, so air is going to go out. And so that's basically what allows us to breathe. So those changes in pressure within the lungs are due to the diaphragm contracting and relaxing. So if I talk through this, so the diaphragm contracts, the lungs expand, because remember the diaphragm contracts, it goes down. That allows the lungs to expand. The pressure in the lungs then drops below 760. You get that gradient, so air is going to come into the lungs. And that's when we inhale or inspire. And then when the diaphragm relaxes, it pushes back up. The lung volume decreases. The pressure in the lung then increases above 760. And thus you have a pressure gradient going the other way. And that's when air flows out and you exhale or expire. So picture that. So inhalation, you can see the diaphragm kind of going down a little bit. Lungs expand, pressure in the lungs drop, air comes in. Exhalation, the diaphragm relaxes, goes upward, lungs recoil a little bit, pressure goes up, and you exhale. So in addition to the diaphragm, we do have other muscles that help out. So with inhalation, external intercostals are really important too. And remember, they elevate the ribs. So by elevating the ribs, they decrease the pressure in the lungs also and allow you to inhale. So if you take a really deep breath, you might feel your ribs elevating. That's the external intercostals. We also have some muscles called the scalenes up in the neck that can help out. We didn't cover those, so don't worry about them. For exhalation, we have internal intercostals that pull your ribs down. And that would be, if you did a forceful exhalation, you really feel your rib cage going down. And then we have one that also pulls on the ribs called the transversus thoracis, which we didn't cover, so don't worry about that one. But the other one that I want to point out for exhalation, your abdominal muscles. So imagine yourself blowing out birthday candles. You may feel your abdominal muscles really working hard to get that air out. All right, so this is kind of just showing how the rib cage expands and recoils during inhalation, exhalation. So inhalation, ribs elevated, and the thoracic cavity gets wider. Exhalation, the ribs are pulled down and that thoracic cavity narrows. And these are the muscles I was talking about. Scalenes we didn't cover, but here's your external intercostals pulling the ribs up during inhalation. During exhalation, internal intercostals pulling the ribs down. All right, last few things. So neural control of breathing is mainly due to the brainstem. So in the brainstem, specifically in the medulla oblongata, we have a respiratory control center, sometimes called the rhythmicity center. So this is basically what sets the rate and depth of breathing. So it tells the diaphragm to contract and relax at a given rate and forcefulness. In addition to that, if you remember in the pons of the brainstem, we have two centers called apneustic and pneumotaxic, which basically modify the breathing pattern. So basically, I think of it as fine-tuning it. So the medulla sets the rate and depth of breathing, and then if it gets a little too high or too low or needs to change, the pons comes in and alters it a little bit. It's kind of like a checks and balances. And then as far as how the autonomic nervous system plays a role here, it's mainly to do with the airways. So the sympathetic nervous system dilates the bronchioles to basically allow more air in. Parasympathetic will constrict. So you think about this, fight or flight response, you're scared, you want to get as much air in as possible. So that's when the sympathetic would dilate the bronchioles. When you're resting, they constrict a little bit because you don't need that much air. And this is just showing kind of the map of what we talked about. So in the medulla, we have the respiratory control center. And in the pons, we have the apneustic and pneumotaxic, which send feedback and kind of fine tune the breathing pattern.